Hey there, it's Melissa Brunetti, and welcome to the Mind Your Own Karma podcast. Hey there, Karma crew. I am back, and I am so glad you are here. Thanks for joining me for this first episode of Season 4 of the Mind Your Own Karma podcast. Have you ever felt like your body was betraying you? Struggling with pain, fatigue, or other mysterious symptoms, only to be told by doctors that everything looks normal. Let me tell you, you're not alone. I was one of those patients, and if you have ever been one of those patients, you will want to hear what my guest has to say today. This episode is a must listen for anyone who has been frustrated by endless medical tests with no clear answers. My guest, Dr. David Clarke, is a leading expert in the mind-body connection and works with the Association for Treatment of Neuroplastic Symptoms, a 501c3 nonprofit dedicated to ending the chronic pain epidemic. Dr. Clarke holds an MD from the University of Connecticut School of Medicine and is board certified in internal medicine and gastroenterology. His mission is to help people understand how unresolved emotions and stress can manifest as very real physical conditions. If you're tired of hearing it's all in your head or you're searching for answers beyond what traditional medicine has provided, this conversation might just change everything. I'm not even kidding. This conversation might just change your life. Let's dive in. So we are welcoming Dr. David Clarke to the show today. Hello.
Hello, great to be with you, Melissa.
Yeah, well, thank you for being the first guest on season 4 of Mind Your Own Karma. Like I told you before we started recording, I'm kind of pivoting a little bit. The last couple of years have really focused on adoption topics and really kind of educating the world about adoption and adoption trauma. I think a lot of people don't understand that or don't want to understand it because it's not comfortable. And just to, kind of think that you can take a child from their biology and just place them with strangers and that we're blank slates and we don't remember that. So how could it affect us is kind of what we hear. And so my whole purpose was to educate the world a little bit on that. And just in my own experience in like the last couple of years, where I realized that even in the womb, I was there when my mother had to make these crucial decisions about giving me up for adoption and losing her mother. Her mother died while she was pregnant with me. And I was just thinking, I was there. I was being formed at that time, and all those hormones and stress hormones were going through her. I was experiencing that as well. And how did that affect me being formed at that time? So super excited to like dig into this conversation and learn the science about it. Like I said, I'm kind of the student when it comes to the science of this, although I'm a somatic practitioner. So just kind of learning about this stuff is going to be fun today. So thanks for coming on.
You're very welcome. Yeah, it's a rich topic, and there are a lot of issues that, as you pointed out, can remain in the fog, and people don't necessarily recognize all of the things that are going on. But if they do, if they can come to understand it, both in general and specifically for themselves, it can make a huge difference in how successfully they function in the world and in my own particular practice in alleviating some of the pain or illness, physical pain or illness that can come along with this.
Yeah, I was in a Zoom meeting with a bunch of adoptees, and this one older gentleman said, and I wrote it down and I still have it on my wall in my office. He said, I have had body pain ever since I can remember, so probably 4 years old. And he says, I have no idea where it's coming from. I don't know where it's coming from. And he's 65, 70 years old. And I was just like, what is missing here? Something's missing. You can't tell me that we can't do something about this. Like it just didn't make sense to me. So then I started
Yeah.
digging in and finding the body connection and all that. So yeah, super exciting to talk about what got you into this. I know, you're a medical doctor background. I'm a medical background as well. And kind of like you, I was seeing patients and I couldn't help them. I couldn't figure out what was going on with them. So how did that look for you? How did you make the
Well,
transition?
I was very traditionally trained. I mean, I come from the Western tradition, 100%, and I was successful in that world, and under the mistaken impression that I was destined to be an excellent physician, and that I pretty much knew what I needed to know after 7 years of formal training. I was getting high scores on exams. I got an award for excellence in medical school. I was in my dream residency program in a hospital training program. So the last thing I expected in the 8th year of my formal training was to encounter a patient I didn't know the first thing about diagnosing or treating. And this was a woman who was 37. She had a severe medical condition. Another university hospital had failed to find any reason for it. We did some specialized testing that was also normal. But in the course of doing her exit interview, where I was basically telling her, you're going to have to live with this, uh,
Yeah.
I stumbled on the fact that she'd been molested as a girl. And she was telling me this in a perfectly calm voice. I'd never heard it from a patient before. I didn't know what to do with it. I was afraid if I asked her too much, I might precipitate a crisis or make her condition worse. But we had nothing else that we could do for her. So um, I got the story from her, and it was a severe one. And fortunately, there was a psychiatrist at UCLA where I was in training that knew that uh, stress and trauma from the past could affect an adult and cause real physical pain or illness. So I got an appointment for the patient with the psychiatrist, forgot all about her, went back on my training program. But 3 months later, I ran into the psychiatrist, Harriet Kaplan, in an elevator. And this was the elevator ride that changed my career because between the ground floor and the fifth floor, I found out that she had cured this patient with about 10 sessions of counseling, which absolutely blew my mind. The idea that you could alleviate a serious physical illness just by talking to somebody. Nobody had ever mentioned that. It's kind of embarrassing to admit that, as a doctor, nobody ever said that you could alleviate people's pain or illness through counseling if the cause was coming from the brain, which in millions of people, that's exactly what's going
Mm.
on. But, I learned from Dr. Kaplan. She gave me a framework for how to think about this. I didn't think it would be something I would use very much, but there are millions of these patients. 40% of people who go to a primary care doctor, this is what they have. Symptoms are 100% real. I was
Yeah.
seeing 5 or 6 a week. And the mental health profession was mostly not able to help them either. Cognitive behavioral therapy really doesn't do the job when it comes to this particular problem. So a lot of those patients would come back after having seen a mental health professional. They'd still have their symptoms, and they would ask me to do what I could for them. And even as a bumbling beginner, uh, they were getting better, and that was very rewarding professionally and personally. So I kept going with it, and now today I'm 7,000 people later that I've successfully diagnosed and treated with this condition.
That's amazing. So what this was back in the 80s, right?
Right.
So we're 40 years later. And why do you think that why have they not caught up with this? Is it because
Well,
of
they're
insurance
starting
or?
to. They're
Okay,
starting to. There are two
good.
reasons. One is it's a completely different way of thinking. I mean, most of us were trained, and most of the public assumes that if you've got pain or illness, it has to be from a disease or an injury.
Yeah.
But it turns out there's this whole other category that affects 1 in 5 adults, where the brain is actually generating the pain or illness in the body, even when there's nothing physically wrong. So it's a completely different way of thinking about pain or illness, and it's quite a shift. It certainly was for me to make this change and to a whole different set of railroad tracks that you're going down when you're evaluating a patient. The other issue is that until recently, we didn't have really good science showing just how powerful this
Mm.
treatment program can be. But now, in the last few years, there are excellent clinical trials published in top journals from across North America that are showing dramatic benefits from using this approach. The Boulder back pain study is a good example. They took people with back pain for an average of 10 years, and in 1 month of treatment using what we're now calling neuroplastic recovery therapies, they had a 75% decrease in pain on average. You have to imagine this, 10 years it's going along, and then boom, 1 month, 75% drop with 8 sessions of the neuroplastic recovery treatment. And there's studies that are confirming that, like I say, from all across North America. So that gets people's attention. The Boulder study got national news coverage, and physicians are beginning to sit up and take notice. And when they learn how to do this, on our website, symptomatic.me, we've got a number of training courses, a couple of textbooks. When people learn how to do this, they love it. It transforms their practice. One doctor took me aside at a conference and said that these ideas had put the joy back into her work.
Wow. Wow. That's amazing. That's amazing. Can you explain what neuroplastic symptoms are and how they manifest in conditions like chronic pain?
Yeah, neuroplastic means basically that the brain and nervous system are involved, and the plastic part of the term is very hopeful, actually, because it means there's a capacity for change. So these are symptoms that are generated in the brain and felt in the body. And they're generated in the brain because of some kind of stress, trauma, emotions, other challenge in life. And they can cause symptoms literally from head to toe. Migraines, tinnitus, which is ringing in the ears, dizziness, visual disturbances, pseudo seizures, trouble swallowing, facial pain. Back pain is a huge one. Fibromyalgia, irritable bowel, pelvic pain, genital pain, joint pain, certain kinds of rashes, many cases of long COVID or chronic fatigue, complex regional pain syndrome, functional neurologic disorders. I mean, there are literally over 100 of these different
Oh my
conditions,
gosh.
many of which can occur simultaneously in the same patient. My record patient had 27 different symptoms at the same time. They can move from place to place is another characteristic. They can go on for decades, like your gentleman who was 65, who'd been having pain as long as he could remember. My personal record patient was 87, and she'd been having pain since she was age 8. So and again, 100% real. I mean, the old idea was that these are in people's heads. The patients who have these are neurotic. They can't handle their own stress. There's nothing you can do for them. You can't diagnose them. They're going to have to just live with it. Not a single one of those assumptions is true. My patients who have this condition are actually, in my experience, mentally stronger than average. They're
Yeah,
just being asked to carry humongous amounts of stress that even they don't fully recognize.
right. Well, because you're in survival mode and you do what you got to do to survive but pretty soon it all catches up to you. I became
Yeah,
one of those patients myself, like I said, doing ultrasound forever. I'd see the same patient year after year with the same pain, and they could point exactly where the pain was, or they couldn't swallow. So I was looking at their thyroid or something, and you'd have no nodules. Esophagram was clear, like there's nothing. Um, and it's just frustrating. It's frustrating as someone who gets into a field to help people and you can't help them, you know?
yeah, yeah. Oh, I can only imagine what my practice would have been like if I didn't know how to do this. I know many physicians who are seeing, in primary care, 40% of their practice, and they don't know what to do. And it's incredibly frustrating. It contributes to burnout. Something like 65% of physicians are experiencing at least one sign of burnout these days. And if they learned how to do this, it would go a long way toward alleviating a lot of that. Because all of a sudden, you take a bunch of people that you don't know what to do for, and you flip them into a group that is incredibly rewarding to work with
Yeah.
because they get
So,
better.
so does the physician themselves do this therapy with the patient, or do they refer them out, or how does that
Yeah, it's a
work?
great question. The best outcomes happen when they collaborate with a mental health professional. So the physician does the diagnostic evaluation to make sure that there's no organ disease or structural damage going on. And then they'll just ask, a few basic questions to inquire about sources of stress in the patient's life. what's going on in your life at the moment, making sure that you don't have a depression or an anxiety disorder, or making sure you haven't been through a trauma. And then a big area that I ask about in all of my patients with this is, did you go through stress as a child? Did you go through experiences as a kid that you would never want for a child of your own, for example?
Yeah.
And, we can talk about that. And oftentimes people don't fully recognize just how adverse it was for them. They'll start out by telling me, it wasn't that bad. Other people have been through worse. I think I'm over it now. But when I ask them to imagine a child of their own going through the same stuff, and that they have to, say, pretend that they're watching the kid try to cope, even for just a week or 10 days, they get a completely different impression of the reality of what they had to deal with.
Yeah. And I think on every medical intake, it should ask if you're adopted, because the narrative out there and that many adoptees don't even, have never heard that adoption can be traumatic. Um, and so I think that should be on every intake, because that is something that um, I think needs to be addressed. I think it's super important to ask
Yeah,
that question. It
the common denominator in my patients is that they had experiences that led them to question their own self-worth.
hmm
And an adoptee is always going to have that question. What was it about me that led my own parents to give
Yes.
me up? And
Yes.
there may have been an incredibly good reason for it that,
hmm
anybody could agree with. But it's a question that kind of hangs there in the air over your head as you're growing up. You may not initially be asking that question of yourself, but sooner or later, the question is going to be there.
Yeah. What do you say to people that don't think that don't have that correlation between the mind and the body? And so they're like, this can't be mental. This can't be some trauma in my body. What do you say to those people?
Yeah, that's very, very common. In fact, there were some researchers that were on the radio not too long ago, just in the last month or two, studying long COVID and chronic fatigue. And one of them made the comment that this couldn't possibly be mental because the symptoms were so severe. I mean, they had been severely debilitated for 3 or 4 years. And these are people with PhDs, they're scientists, they're researching this. So they're mentally very capable people, and certainly able to analyze the situation that they're in. But they had come to the conclusion that I don't have anything going on in my life that's capable of creating this level of illness that they had. But it turns out that's not true, and I emphasize that to patients that this brain to body condition, neuroplastic condition, can produce any level of symptoms. One of my patients, again, 79 years. Another patient was a teenage girl whom I was asked to see on her 70th day in the hospital for unexplained abdominal pain. She had had this pain for 18 months. She had seen previously 6 other specialists. I was number 7. She was getting morphine around the clock in massive doses for this pain. It was 100% stress related, as was the woman with the 79 years, because we uncovered the stress, we addressed it successfully, and both of those patients got better. So it shows you just, and I had to learn this myself. I was also of the opinion that brain to body stress related neuroplastic pain could only reach relatively minor levels of severity when I first came to this. But I had to learn through a direct experience with severely ill people just how bad this could get. And so I tell people who are skeptical, yeah, this can happen, and it needs to be taken seriously, just as seriously as pain from organ disease or structural damage.
Definitely. Definitely. How might early life trauma, particularly talking about adoptees, how does that contribute to the development of neuroplastic symptoms?
For me, the common denominator is that, any treatment of a child that makes them feel somehow less valuable than others. And that can play out in so many different ways, but something that makes you feel second rate, or in some cases, worthless. And it can be very obvious, abuse or cruelty or uh, chaos in the home in the form of substance abuse by a parent or violence in the home. All of those things can make a kid feel like, what is it about me that um, these issues are happening in my home? Because that's what kids do. They look for uh, personal responsibility in whatever bad things are happening in their home. And it can be a lot more subtle than that, though. One of my patients, the only time he got praise or support from his parents was when he could do something better than his brothers and sisters could do it. And it turned out his brothers and sisters, he had three of them, were very accomplished people. And it wasn't easy to do things better than they could do it. And consequently, he grew up feeling like a failure. And that played out into, there are a number of long-term consequences from these, early adoption of negative assumptions about yourself. And he had a lot of those at age 37 as an attorney that were creating stress for him at that age that was then playing out in the form of physical symptoms. So
Yeah.
we can talk about what some of those consequences are, but often when I'm tracing it back to the roots, it starts out with people absorbing those false assumptions that they're not good enough, or that it's their job in life to fix everybody else's problems, or that they don't deserve to take time for their own joy. So those kinds of things, or that they need to be perfect, or they need to always be focused on the needs of everybody else. Those kinds of ideas that become a part of how you think about yourself, they are highly stressful for adults.
Yeah. And that just manifests in so many things. I mean, not just physically, but do you ever see like mentally, like schizophrenia or anything like that? Can it morph into?
Schizophrenia, not so much, but depression, definitely. Anxiety, absolutely. Symptoms of post-traumatic stress, most definitely.
Talk about food and diet and like gluten-free and people who have sensitivities to certain foods.
Yeah, if you've got celiac disease, then you've got an intestinal allergy to gluten, and there are tests that can confirm that. But there are a whole lot of people that believe they have a food sensitivity or a food allergy, and they actually don't. And what's going on is they will have stress-related gastrointestinal symptoms, which are very common because the brain is so heavily wired to the GI tract. And the GI tract has its own nervous system that's got about as many nerves as your spinal cord does.
Mhm.
So there are lots of crosstalk going on back and forth between the two of them. So if you've got stress going on, you'll often feel it in your gut. And when you do, you may not connect it with whatever stress is happening, because that's a common issue for my patients. They repress their emotions around stress so that when they're feeling the stress, they're not feeling it consciously. They're
Right.
just feeling it in their bodies. So they're thinking about, okay, something's happening in my body here, and especially in my GI tract. Why is that happening? Well, maybe it's something that I just ate. And they will blame the food. And then the next time it happens, they'll blame the food again. And they'll start, in some cases, eliminating these foods from their diet because they're afraid of them. And I've had patients who've come to see me and they're down to white bread and rice and water and extreme restrictions of their diet because, over the years, one by one, they've eliminated food after food. But the majority of the time, it's not the food.
Yeah. So you talk about deep stress. What is that, and how does it relate to adverse childhood experiences?
Yeah, deep stress is, I have to say, not a term that's in common use, but I like to use it from time to time to mean stress that people don't fully recognize is going on. And This has to do with those basic assumptions that I was mentioning earlier, that you have absorbed ideas about yourself that are not true, that you're a second-rate person, or that it's your job to care for everybody else in your world, for example, or that you need to be perfect, or that if you make a mistake, you need to come down on yourself, really hard, much harder than you would for somebody else who made the same mistake. So all of those things can be going on without, a whole lot of conscious awareness. And so that's why I call it deep stress, because it's kind of like swimming against the tide, trying to live your life while all of these issues are happening in the background or beneath your awareness.
So you talk about three characteristics of deep stress. What are those three characteristics?
One of them is you're not consciously aware of it. Another is that they can cause physical symptoms in the body. And another one is that they can cause mental symptoms. They can cause depression or anxiety or constant vigilance. Um, and if they're really bad, it can cause post-traumatic stress kind of symptoms like nightmares and flashbacks and avoiding situations or people because they remind you of the trauma.
And how is that linked to the chronic stress or an illness, possibly?
Yeah, all of those things create stress for a person or magnify the stresses that you already have in your life. And that can then play out in the form of physical symptoms. The long-term consequences of adversity in childhood fall into three categories. One of them is personality traits, which I've already mentioned, the perfectionism and um, being highly self-critical and not taking enough time for your own joy on a regular basis. But also sometimes things like choosing partners for yourself that for relationships that are less than ideal, where you will find yourself giving a whole lot to that other person and not getting so much in return. And so the relationships are unbalanced. The second major area in which the childhood adversity plays out are what I call triggers, which are people, situations, or events that are highly stressful for you because they are in some way reminiscent of the past or linked to the past. The most common example there is a parent who mistreated you in some way, who is still in your life today. And then finally, and the most difficult, but probably the deepest of the stresses are emotions, um, again, that you're not consciously aware of. Most frequently anger, but also sometimes fear, shame, grief, or guilt. And people can have enormous amounts of those and not be consciously aware of it. They kind of remind me of dormant volcanoes on the outside with boiling magma on the inside that only bursts out occasionally. But all of that emotion can be manifested via the body. Emotions always manifest via the body, but in people with this condition, they do it a lot and they do it forcefully.
Yeah, interesting. What do you think about patients that have neuroplastic symptoms but say they haven't had any childhood experiences, any adverse experience?
Yeah, definitely exists. You can have enough stress going on in your life right now that can create these symptoms. A very simple example was a patient of mine that he only got his symptoms when he was driving to work.
Mm,
When he was driving home from work, he was fine. On the weekends, when he was not at work, also fine. So, just asked him what was happening at work. And, he had been having symptoms for about 9 months. And it turned out 9 months before, he worked in a two-person office in a large company. And his partner in that office was transferred to another location in the same company, 1,500 miles away. So instantly, his workload doubles.
yeah, there you go.
And
How
it
do you,
really helped him a lot just to see that because he hadn't been aware of it, and
yeah,
none of his other doctors had asked him about the timing.
that's funny. Yeah, it's interesting to kind of look back at timelines and I heard you on another podcast and one of your patients something happened when they were 8 years old and you were like, it started happening when they were eight, their symptoms, and you were like, well, what happened when you were eight? It's like
It seems like a
it's so
simple
simple.
question, doesn't it?
Yeah, it's so
Yeah, no,
simple.
that was a
Yeah.
big trauma. That was the woman who came to my office at age 87.
Okay.
Yeah, I mean, and I asked her, how long have you been having this pain? And she said, ever since I was 8 years old. I mean, anybody with an orientation toward illness that like mine is going to immediately leap to the question, what happened when you were eight?
Right.
And what happened was tragic. She grew up on a farm in rural Idaho, and she was the oldest child. When she was 6, her mother had a baby, and I think it was the third or fourth child in the family at that point. And mom was busy on the farm, so she gave care of the baby to my patient at age 6. And so she fed the baby, clothed it, changed it, played with it, slept with it for 2.5 years until the baby, to the now toddler, got appendicitis and died.
Oh.
You know, utter and complete shock for this, poor 8.5-year-old girl. And the whole town comes to the funeral, and she's in shock. And one of her relatives points out that she's the only person in the church who is not crying.
Mm.
And her guilt level was already high. And when she heard that, it just went off the charts. And her stomach pain started soon after that. And it affected her whole life. She started caring for other people's kids on neighboring farms. She became a pediatric nurse for her career.
Wow.
She had 4 kids of her own, and as you can imagine, raised them very carefully. Um, one of her sons was with her in the office, and he had never heard the story about the death of the toddler. And
Mm.
a big part of her treatment was to write that toddler a letter
Yeah.
and just explain what had happened, explain her perspective, and ask forgiveness. And
Mm.
made a huge difference for her. She, didn't think about that event too often, but her physical symptoms were tremendously alleviated when she finally had a chance to put all of those feelings into words.
Yeah. Wow. That's amazing. How do you assess a new patient that has pain or illness, but no disease or injury that you can find?
Yeah, start with what I call a stress evaluation. People go to symptomatic.me. There's a 12-question quiz that covers a lot of this, and people can assess themselves for whether their symptoms could be connected to this. But essentially, I'm first wanting to make sure there's no disease or injury going
Mhm.
on, and I may need to do diagnostic tests for that in some cases, in many cases. But then I'm also doing a stress evaluation. What's happening in your life at the moment? Is there any connection in timing between when your symptoms are up and when your stress level is up? Can I find a connection like that? I don't always, but if I do, it's good circumstantial evidence that we're on the right track. A good example is a patient who had his back pain every single day, except 2 weeks out of the year when he was on vacation. He was quite active on vacation, so there was no doubt that he had a stress-related back pain. What else? Another area that I look at is, what are you doing for your own joy?
Mm.
Are you taking time to put yourself on the list of people you take care of? And are you doing that on a regular basis? Or are you one of these people that is on a treadmill that you are constantly working on behalf of everybody else in your world, and you're not putting your own oxygen mask on
Yeah.
at any time? That's very common.
Yeah.
Then I'm wanting to make sure that people don't have depression, anxiety, or post-trauma. Those can be subtle. I mean, they can manifest physically more so than they manifest mentally. So I have to look for depression, for example, how are people sleeping? How's their appetite? How's their energy level? Are they having thoughts of harming themselves? Have they lost interest in things they used to love to do? Those are all symptoms of depression, and many people will have those even when they don't feel especially depressed.
Yeah.
They may experience frustration or stress or just a desperation to have the physical symptom that they're coming to see me about alleviated, but
Hmm.
they won't necessarily feel subjectively depressed. Anxiety disorders too. When people are in a place they consider safe for them, often their symptoms will be less severe or less frequent. And that's a real clue to me that anxiety is going on. One of my patients there, she had terrible diarrhea. She was putting herself, taking huge amounts of anti-diarrheal tablets and putting herself on a diet restricted only to water on her bad days. But it turned out, and nobody else asked her this, her bad days were only on Tuesdays and Thursdays.
Oh my goodness. Wow.
On the weekends, she was fine. So, I don't think you have to be a doctor to know that your bowel is not responsible for this. I mean, your bowel doesn't know if it's Tuesday or Thursday or Saturday. Only
Right.
the brain knows that. So the
Yeah.
brain has to be involved here. And what was
Right.
going on was she played varsity soccer for her high school. She was extremely anxious about her performance in competition. The games only took place on Tuesdays and Thursdays. I never had a game on weekends. And if on a particular Thursday there was no game, only practice, no diarrhea. So that was a
Yeah.
great example of an anxiety disorder.
Yeah.
And then the trauma, if there happened to be somebody go through a trauma and then their symptoms begin soon after that, that's pretty clear. Story told to me by a colleague of mine was of a woman who'd been ill for 6 months. Nobody could figure it out until he asked her about trauma. And it turned out right before she became ill, she'd been a hostage during the robbery of a store. And for 40 minutes, somebody had a handgun pointed at her
Oh
neck.
my gosh. Wow.
And sometimes the trauma is remote, that it took place many years before the illness began. And in those cases, there's almost always some kind of trigger that did happen right before the symptoms began that's linked to the trauma. Try to make it somewhat brief, but there was a patient of mine that what triggered her illness was seeing her brother's murderer in a store, unexpected.
Mm, mm,
She
yeah.
had become ill after the murder. She became ill when she saw his killer in a store.
Yeah.
And that was
Um,
years later.
yeah.
And
So what
finally,
is,
the
yeah,
last
go
part of
ahead.
the stress evaluation is the adverse childhood experiences. And I'm careful to ask people, if they did go through some things, but they're not sure about how severe it was for them, I'll ask them to imagine a child of their own going through the same thing while they watch. And they're a butterfly on the wall and they can't do anything about it. They just have to watch. And how significantly affected would they be to see that? That helps people get a more realistic sense of how much they went through.
Yeah, I love that technique. That's really helpful. I think for a lot of people that kind of disassociate, and just, yeah, I'm fine, I'm fine.
I've heard
Everything's
that
fine.
so many times.
Right. So how can health professionals be better equipped to recognize and treat neuroplastic symptoms?
Well, a lot of the ideas we've just been talking about, you can use them in clinical practice every day. And even when you're a beginner, they're effective. I can tell you that from personal experience. But we've got on symptomatic.me, we've got several training courses and another one we're going to release soon. We have 2 textbooks. They use the older terminology of psychophysiologic disorders rather than the new term of neuroplastic, but they were published just in the last few years. They've got international experts contributing their ideas there, and anybody can learn this. I mean, I'm a gastroenterologist. I don't have a formal credential in psychology, but I learned how to use this in my patients and to collaborate with mental health professionals. These stress evaluation questions would uncover the issues and then a mental health professional could take over because it's in their training experience. They're not usually as comfortable with dealing with physical symptoms, but if you tell them, oh, we've got a adverse childhood experience survivor or somebody with depression, that's what they do. So that between myself and the mental health professional, that's how we get the best outcomes for people. And they can sometimes be dramatic. In my first book, They Can't Find Anything Wrong, the first story was a patient who was hospitalized at a university 60 times in 15 years for her attacks of severe dizziness and vomiting. And they had no diagnosis. She'd seen a dozen specialists. She had every test in the book. They even had a psychiatrist talk to her who pronounced her mentally healthy, which she was. But she had been through a trauma as a girl. Nobody had really uncovered it. And we had a conversation about it, and she was cured on the spot. She never had another attack. She went home from the hospital the next day.
That's crazy. How rewarding was that?
I went home that day. I can still remember this. I went home and told my wife, this was very early in my career. And I thought, I told my wife, I think I am onto something here. I mean, that woman had been hospitalized at Stanford University 60 times, and they couldn't diagnose her. And I cured her in less than an hour. I really thought, this is something I need to do as a major part of my career.
Yeah, that's definitely life-changing right there for everybody. So let's talk about the Association for Treatment of Neuroplastic Symptoms. What's the story behind the formation of that?
Well, most of us who were doing this work around the country 15, 20 years ago didn't know anybody else who was doing it. We'd all found our way to this independently. A few people had learned from a mentor in New York whose name was John Sarno, but most of us had found this independently, and we didn't know anybody else was doing this. And there was a conference where we all came together in Ann Arbor, Michigan, in 2009. And it was a revelation to all of us that people from so many different branches of the healthcare profession were all doing this work. And we decided we had to create a nonprofit. And we're all volunteers. None of us gets any money for this. Whenever I get paid for giving a speech, I donate all of it to the nonprofit. Same with my book royalties and any other money that comes my way from this. We don't want even the appearance of a financial conflict of interest. And we've just grown ever since then. We've had international conferences. We had 270 people from 8 countries that came to Colorado last September. We've published 2 textbooks, produced 3 documentary films. We've created all kinds of online courses. We've sponsored research. We're just growing every year. It's been wonderful to see.
I need links to all this to put in the show notes so people can access this stuff.
Symptomatic.me is our new website. We just launched that as well in February of 2025.
I loved that. I love the play on the word up there, symptomatic to somatic. I love that. So, what steps can individuals who suspect their chronic illness is linked to some past trauma take? What should they do? How can they seek treatment?
Yeah, they should start by taking the 12-question quiz on symptomatic.me. Each question is set up in a way that the more questions to which you answer yes, the more likely it is that your physical symptoms are linked to stress or trauma or to a neuroplastic process. Each question also comes with a line or 2 of explanation so that you get an idea of what the meaning of it is. And then if it seems that this is a possibility, then you can look into it more. There's information about all kinds of individual common conditions in this area. And then there are resources for self-treatment. If people support us by becoming members, they have access to a self-treatment course and to monthly question and answer sessions on Zoom with international experts.
Wow.
There's also the courses we have for professionals are done without jargon. So people who are interested in the science, even if they're not professionally trained, they can get a lot out of it and learn from that. Finally, if all of that is not enough, I mean, there's all kinds of books as well that we list the ones that are scientifically vetted and evidence-based. And then there's also a directory of practitioners for people that need even more than that. Practitioners who've taken extra training on top of their professional license to learn about this condition.
Yeah, I'm gonna have to check that out myself. Your organization promotes neuroplastic recovery therapies as a treatment for chronic pain and illness not caused by disease or injury. Can you elaborate on this approach and its effectiveness compared to traditional methods?
Yeah, absolutely. They are proving to be much better than traditional methods when tested in clinical trials. I mentioned the Boulder back pain study. There's a one that was done at UCLA where they had older male veterans with musculoskeletal pain,
Mm,
and they treated them with one of the new forms of treatment and got, I believe it was 2/3 of them got at least 30% pain relief compared to the older cognitive behavioral therapy where only 1 in 6 got improvement. So basically, 4 times as high a rate of improvement using the new form of treatment. And what is the new form of treatment? Well, it starts with shifting your attention from whatever's going on in your body to where it's coming from, which is
mm,
generated by the brain. And just to be aware of the symptom and to start thinking of it as a form of communication from your brain, that your brain is trying to tell you that it is in a state of distress. And that's what the meaning of the symptom is. And once you understand your symptoms in that frame, there's a lot less fear involved. It's no longer something to be afraid of. It's more something to be curious about and to try to understand the meaning of. And the meaning of it then is the next phase, which is to start looking for stresses, traumas, emotions, other challenges in life that might be behind this. Whether in the present day, like my patient whose workload doubled instantly, or from the past, that there may be more issues related to adversity in childhood than you've appreciated so far. And that could be what your brain is trying to tell you through these symptoms. So through those kinds of ideas, people begin to recognize the real source of their condition, and they get better. Not always, on the spot, like the patient with 60 admissions to Stanford, but some people need years of psychotherapy to get to the same level. But everybody can be on a pathway toward improvement, and it's so reassuring to see that. You go from a situation of wondering if you're going crazy or wondering if your body is going to turn out to have something horribly serious,
yeah,
to all of a sudden knowing, what's really wrong and knowing what to do about it.
what a relief. I mean, right
You,
there, huge. Yeah, huge. So, what advancements do you foresee in the diagnosis and treatment of neuroplastic symptoms, and how might they benefit individuals dealing with trauma-related conditions?
yeah, we have developed these techniques to a very high level. The traditional forms of treatment, I don't want to get too far into the weeds of the statistics and the research here, but there's a number called effect size that I think anybody can understand, that is a measure of how impactful your treatment has been on a group of patients. And the older forms of treatment would get a number like zero point 0.2 or 0.3, which was, barely better than placebo or,
Yeah.
sugar pill or injection treatment. The Boulder back pain study effect size was 1.5. So we're talking, 4 or 5 times bigger an effect than had been seen in the past. So it's been very well developed. So our issue now is not so much improving on the treatment as it is getting the word out, helping healthcare professionals and patients themselves to take advantage of these techniques and use them effectively for themselves. But there's only, a matter of hundreds of people who are professionals that know how to use this. And there are 50 million people in the United States alone that need this.
Yeah. And I think part of the problem too is educating people that this is a thing, that this is a possibility in the realm of your healthcare, that it might not be something that, your doctor can necessarily help you with, that it's maybe goes beyond that. I don't think
Yeah.
like a lot of people make that correlation. I think it's still kind of um, in the dark. I don't know.
Yeah, we need the general, if the general public understands that your brain can cause real pain or illness in the body, and the healthcare profession, medical and mental health, understand this as well, the level of human suffering from this is just going to diminish dramatically.
Yeah.
But we've got a big job in front of us of both professional and public education.
Yeah, I know when my doctor he tried everything. He was even asking me, what do you want me to try now? He ran out of things and pretty soon he was just pushing pills at me and that was, basically all he could do until
That's
uh,
how we're trained. Yeah. And
yeah,
but we have, there's a document on our website too about how to talk to your doctor about,
awesome.
or, what to communicate to your doctor after you start getting better through these techniques. And you can, we encourage our successful patients to educate their physicians. I've also got a new podcast of my own. It's called The Story Behind the Symptoms, where I interview patients, much as I used to do in my office. And we get into some pretty deep detail. And any patient who sees that is going to undoubtedly get some ideas about their own situation. Same with physicians and mental health professionals. If they see how one of these interviews is conducted, it's really eye-opening.
Yeah. I need the link to your podcast too, so I can put that in the show notes. I'm sure people want to check that out. Kind of in closing, what would you like any listener that thinks they might be experiencing symptoms to know?
First of all, and above all, that there is hope. Um, you know, Patient with 79 years of symptoms, relieved. Patient getting massive doses of morphine around the clock, relieved. Patient with 27 different symptoms, relieved. Patient with 60 admissions to Stanford. I mean, when I walked into her room, she said, "Doctor, thank you for coming, but don't waste your time.
Wow.
You'd be better off seeing your other patients." Relieved. So tremendous hope for people with this. If anything, it's a more hopeful condition to have than all of the organ diseases and structural damage that I dealt with in 2/3 of my practice. There are a lot of those patients I could not help. Almost all of patients with neuroplastic conditions, I can definitely help.
Yeah. So remind us again where we can find you, and we'll put all those links in the show notes, but remind us again where we can find
Yeah,
you.
symptomatic.me is the website, and there are links there to the Story Behind the Symptoms podcast and to that 12-question quiz for self-assessing yourself. So that's kind of where it all starts. My first book, which was written for patients, which is, mostly comprised of about 4 dozen stories that illustrate the spectrum of this, is titled They Can't Find Anything Wrong.
I love that. Because I was one of those patients that couldn't find anything wrong.
Yeah, I
Yeah.
took that from the Stanford patient actually, because she told that to me when I walked in. As soon as I convinced her that I wasn't going to be put off and I was going to listen to her story one more time, and she just said, "They can't find anything wrong."
Mm,
And it was a memorable case, and so I remembered those words and used them for
yeah.
the title.
Yeah. Well, thank you so much for coming on and being my first guest for season 4, educating me on the science of this. I've learned a ton. I'm going to go on your website again. I've already been on there, but I'm going to go on there again and look at some more of this stuff. So thanks so much for coming on today.
I'm honored to be on your first episode, Melissa. Thank you so much.
Wow. Did you find that as impactful as I did? If you know of anyone that would benefit from hearing this podcast today, please share it. It really could change someone's life and give them hope that they aren't crazy, their symptoms are real, and that there is a treatment. Dr. David Clarke's insights on the mind-body connection are truly eye-opening. If you've ever felt trapped in a cycle of unexplained pain, fatigue, or other symptoms with no clear diagnosis, I hope this episode has given you a new perspective. And if you've been struggling with physical symptoms that might be rooted in trauma, or if you feel like something's hidden and is keeping you from fully living a life that you love and deserve, I'd love to help. As a somatic mindful guided imagery practitioner, I guide people through powerful imagery and body-based practices to uncover and release deeply held emotional pain, past traumas, and subconscious blocks. As you heard today, our bodies often store unresolved experiences, and by tapping into this connection, we can create space for true healing and transformation. If this resonates with you, don't hesitate to reach out to me at somatichealingjourneys.com. And speaking of healing, I am so excited for season 4. This season, we're diving deep into healing modalities, both holistic and lesser known ones, that can help transform your life. While I remain dedicated to supporting the adoptee community, I think it's time to share stories, tools, and healing modalities that have worked for others. Hopefully, in that process, you will find your healing combination here at Mind Your Own Karma. If you know someone who would make a great guest, please reach out. You can email me at mindyourownkarma@gmail.com. As always, take what you need and leave what you don't. And always remember to mind your own karma. I'll see you next time.